It has been an ongoing debate really since the start of the pandemic. Should schools remain open?
Across the country, some school districts like Los Angeles and Chicago made the decision to switch to virtual learning as coronavirus cases rose in those areas. But some of the nation's top health officials say kids can go to school in person and safely. President-elect Joe Biden laid out his goal to open most K through 8th grade schools by the end of his first 100 days in office. And now a new study out of Mississippi suggests that students who have tested positive for the virus might not necessarily have contracted it in classrooms. NewsNation anchor Rudabeh Shabazi is joining us now with details on this.
Yeah, guys, the bottom line is that children are more likely to be infected by a family member who doesn't take the proper safety measures than at school, according to the study. The author of the study says because children have a lower rate of infection and transmission, health experts are spending more time studying COVID in adults, and children are suffering.
Children are more at risk of contracting COVID-19 at a holiday party or family gathering than they are from being in the classroom, and their parents and guardians are less likely to report wearing masks. That's according to a new study led by the University of Mississippi Medical Center in collaboration with the CDC. Charlotte Hobbs, a mother and professor of pediatric infectious diseases, led the study.
This echoes what we've seen in adult studies with household transmission.
Hobbs says they also found that children who attended school or daycare and tested positive reported that other children or staff members were not taking safety measures, like masking, social distancing, or proper hygiene. The researchers interviewed about 400 parents and pulled a list of children who had taken COVID tests. She says because the disease tends to be less severe in children, it's been studied less, and as a result, children are suffering.
If at schools appropriate mitigation efforts are being observed, being at school is actually, in fact, perhaps much lower of a place where a child would have the risk of contracting COVID as opposed to having contact with an adult who is infected.
California Governor Gavin Newsom unveiled his $2 billion plan for reopening schools this week.
Transmissions among and from younger students to students, is simply not common.
He hopes to be back on track by the spring, with distance learning still an option. Randy Weingarten, president of the American Federation of Teachers, says she believes kids should be in school too, but only if funding is available and assurances are made that the proper safety measures will be taken.
In hospitals, you have those safeguards in place, or people are told to leave. And in schools, particularly when you're working with kids, you have to be extra careful. What is ironic these days is that young kids actually are following the rules, whereas older kids are not. And we actually thought it was going to be the opposite.
And Hobbs, the author of that study, also says even though COVID-19 vaccines are becoming available, now is not the time for parents, families, schools, and child care centers to let down their guard. And remember, the available vaccine is only approved for those 16 and older.